Go.
Knock, knock. Hi. My name's Brittany. I'm going to be your nurse today. We're going to do a head-to-toe assessment on you. Can you just tell me your name and your birthday?
Anthony Fisher, 3/24/62.
Perfect. Do you have any allergies at all?
Penicillin.
Penicillin. Okay. All right. So I'm going to start by grabbing your vitals. Put this blood pressure cuff on you here. And we're going to put this on your finger so we can get your heart rate and your oxygen level. All right. I'm going to take your temp. Start that. 98.6, good. Alright, it looks like your oxygen level is 98% on room air, and your heart rate is 64. Blood pressure 125/78, and your respiratory rate I counted to be 18 breaths per minute. Alright, are you having any pain at all?
Yes, in my right shoulder.
In your right shoulder. How would you describe this pain? Is it aching, burning, stabbing?
It's a stabbing pain.
Stabbing. What would you rate it on a scale of 0 to 10?
It's about an 8.
8 out of 10? What can I do to ease this pain?
Probably just some pain medication.
Okay. All right. I will check with the doctor as soon as we're done here to get you some medicine, okay? Can you tell me where you are right now?
I'm at Sanford.
Sanford. Do you know why you're here?
I just had surgery on my shoulder.
Okay. And do you know the date?
It's January 29th.
Okay. So you don't seem confused. If you did, we'd give you a bed alarm, but you should be good in that area. I'm just going to go ahead and check your skin here on the back of your head, back of your neck. Everything looks good. I'm going to look in both your ears. Okay, I'm going to look in your nose here, in your mouth. Everything looks good. Alright, can you smile for me? Perfect. Good symmetry. Alright, we're going to go ahead and listen to your heart now. I'm going to listen for a full minute. Okay, about 65 beats, and it sounded regular. Just going to take a peek at your skin here. Everything looks clean and dry and intact. Perfect. All right, now I'm going to move down to your lungs. Just need you to take a deep breath in and out for me. Good. Keep going. Good. Good. One more time. Good. All right, they both sound clear bilaterally. Are you experiencing any shortness of breath at all?
No, I'm not.
Okay, well what we're going to have you do, since you just had surgery and we want to kind of keep you in your bed for a little bit, we're going to have you use this incentive spirometer. It helps expand your lungs and prevent pneumonia. What you do is you just put this in your mouth and you inhale deeply and hold your breath, and you want this little yellow marker here in between these lines, and you want to set goals and get to where you need to be, okay? I'll help you come and do that every once in a while. We'll do that about 10 times an hour or so. All right, just gonna have you sit forward here. I'm gonna listen to your lungs in the back and check your skin, okay? All right, your skin looks good. And I'm gonna listen here. I'm gonna have you take deep breaths again. One more time. Now I'm just going to take a peek at your extremities here, your arms. Gonna make sure everything looks good. No redness, no abrasions. All right. Can you squeeze my fingers for me? Good. Now listen to your radial pulse. They're equal and strong. I'm gonna check your cap refill in your fingers. Less than 3 seconds. Less than 3 seconds. Are you experiencing any numbness or tingling in your arms? Your
No.
hands?
No, I'm not.
No? Good. All right, you don't have an IV, but if you did, I would assess to make sure that it's intact still and it's less than 72 hours. All right, now I'm gonna go ahead and listen to your bowels. When was the last time you had a bowel movement?
Yesterday.
Yesterday? Are you able to pass gas?
Yes, I am.
Are you experiencing any nausea, vomiting, or diarrhea?
No, I'm not.
Or constipation at all?
Nope.
All right, listening to all 4 quadrants, they sound, I can hear them in there. They're not hyperactive, but they're active, so you'll probably be having a bowel movement sometime soon. And your abdomen feels soft, and your skin looks good. Clean, dry, and intact there too. All right. Are you continent or incontinent when it comes to bowel movements?
Like,
do you have to wear a brief or anything?
Oh, no.
No? So you're continent, okay. Do you use a bedpan or a commode, or do you go to the toilet?
No, I go to the toilet.
Okay. What about when you urinate, when you void? Do you use the toilet, or do you use a urinal?
Yes, I use the toilet.
You use the toilet, and you don't have a catheter in. Good. So you're continent then when it comes to urinating. You don't have to wear a brief for that as well.
Oh, no.
And when is the last time that you went to the bathroom and you urinated?
About an hour ago.
Hour ago. Do you have any like urgency, frequency, hesitancy, or pain when you go to the bathroom?
No, I don't.
Okay, good. All right, I'm just gonna go ahead and assess your peri area here. Make sure there's no rashes, no wounds. Everything looks clean, dry, and intact down there as well. Good. All right, now we're gonna move down to your legs. I'm just gonna take a peek at your legs here. Feel everything. No edema at all. Good. Check the top of your feet, bottom of your feet, your heels. No redness in those heels. Good. And in between your toes here. Good. Now I'm just going to feel your fetal pulses. Strong and equal. Good. If I wasn't able to feel them, I'd have to use a Doppler. So I'm glad we don't have to do that. Just going to check the cap refill in your toes. Less than 3 seconds. Good. Do you experience any numbing or tingling in your legs or feet?
Nope.
Nope. Perfect. All right. Well, everything looks good there. Laying in bed, you move pretty well by yourself. You're dependent in moving in bed.
Oh, yeah.
Yeah. What about when you ambulate? When you're walking around?
Oh, no. Yeah, I can walk fine.
You don't use a walker or a wheelchair or anything
Nope.
to get around? What about when you transfer from bed to chair or bed to other bed? You're pretty good?
Yeah, I can pretty much get up by myself.
Good. All right. I'm just going to go ahead and lower you here. I'll go check with the doctor to see if we can get you some pain medication. I'm going to give you your call light. So if you need anything, just to let me know. Again, my name is Brittany. I will be your nurse for the day, so don't hesitate to ask if you need anything.
Okay.
I'm going to give you your table here with your water. All right. And your room is free of clutter. Let me know if you need anything. I should be back shortly, okay?
Okay, thank you.
You're welcome.